So when a patient comes to me and asks about surgery for diverticular disease, there are a few things I need to figure out. Firstly, many people have diverticulosis, so they have diverticuli in the bowel, but it doesn't always cause them any symptoms. There's also an overlap between the symptoms of diverticulosis and irritable bowel syndrome. Both of these can cause tummy pain, bloating, constipation, and diarrhea. And furthermore, sometimes diverticulosis and irritable bowel syndrome coexist together. Therefore, we only start thinking about surgery for diverticular disease when it really starts causing problems, such as recurrent inflammation of the bowel, localized perforation where there's a small hole in the bowel caused by the diverticulum, or fistulation, which is where the bowel sticks to and then causes a channel into another organ like the bladder. And when those sorts of symptoms start developing and it really starts impacting on someone's quality of life, that's when we need to start having the discussion about an operation. Can I continue?
Sorry.
It is important to realise that the first episode of diverticulitis, which is inflammation of the bowel, is usually the most severe. So we don't usually do an operation to prevent a more serious episode once you've had one, because normally further episodes of diverticulitis are less severe than the first one. We need to think carefully about the impact that recurrent diverticulitis or inflammation in that bit of the bowel is having on someone's quality of life and balance it against the risks of undergoing major surgery. This is not a decision to rush into, and it should be thought about carefully and definitely over more than one consultation. So there are mainly two different types of operation. In an emergency, we would usually remove the diseased bit of bowel that's causing the problem. It's usually a perforated bit of bowel. And having disconnected the bowel, we bring out the top end of the bowel as a stoma, which is where the bowel's brought into the skin and it's discharged into a bag rather than going out the other end as normal. This is called a Hartmann's procedure or Hartmann's operation. The bowel's been disconnected, the bit of diseased bowel has been removed, the top end is brought out as a stoma, and the bottom end is just left inside. And one of the operations people commonly want after Hartmann's operation or a Hartmann's procedure is a reversal of Hartmann's. That's where we do a second operation to take down the stoma and to connect it to the bottom bit of bowel, which is left in, so that people can start pooing normally again. In an elective or planned operation, we do something different. We usually remove the diseased segment of bowel. It's usually the sigmoid colon, which sits on the lower left side of your tummy. And then instead of disconnecting and bringing out a stoma, we take out the diseased bit of bowel, like in a Hartmann's procedure, but we then join the ends together at the same time in the same operation. With any bowel join that we do, there's a small risk of leak from the bowel join. A bit like any pipe, if you make a join, there is a risk of leak of fluid from the join. And if we are worried about that, then we sometimes bring out a temporary stoma upstream from the bowel join, just to divert any bowel contents away from the join until we're happy that the join has healed, and we can then close the temporary stoma. So in the second in an elective operation, we still remove the diseased bit of bowel, but we plan to do the join at the same time. However, some people still end up with a temporary stoma, although that's usually a different type of stoma than the one that we create during an emergency Hartmann's procedure. So it depends on exactly what the problem is that the diverticular disease is causing, how urgent the surgery is. So, for example, in an emergency, we are less likely to do a join and more likely to do a stoma. And also how sick or how well the patient is when we operate. one of the things we have to consider is leak from a bowel join if we join the bowel up. And in an emergency situation, or people who are very frail or unwell, we have to consider how likely the join is to leak, and how risky it would be to the patient if the join were to leak. So there's a lot of decision making to think about in order to make sure we're doing the right thing for you as a patient. So the main benefit of planned elective surgery is to improve quality of life. One of the most risky time in diverticular disease is usually the first episode of a nasty attack of diverticulitis or inflammation of the bowel. After that, it's less risky. So diverticular disease after the first episode becomes less of a risk to life, and planned elective surgery is usually therefore to improve quality of life. Like any major operation, there are a number of possible risks, which I would usually go through with a patient in detail. These include a leak from a bowel join, bleeding, infection or abscess formation, damage to other structures in the abdomen and pelvis, such as bowel or the ureters, which are the tubes that carry urine from the kidney to the bladder, and blood clots to the legs and the lungs. If we are thinking about planned surgery, then I would usually do at least 2 different consultations to discuss the possible benefits and the severity of impact on quality of life that the diverticular disease is having, and how likely we are to improve that against the risks of the operation and the likelihood it will all go to plan. If it is planned surgery, you would usually spend between 3 to 7 days in hospital after the operation. If you have a laparoscopic or a robotic procedure and you do not have a stoma as part of the operation, the recovery is usually more straightforward than if you have an open traditional operation and or if you have a stoma that you need to learn to manage before you can go home. But overall, the recovery from diverticular disease can take up to 3 months, and your bowel sometimes doesn't work very well at first. It needs to relearn and get used to the new way it is. You can get diarrhea, for example, but usually things settle down over time.